Dr. Berglund here. It has been a long, long time. It's sad. But here's the thing. I'm back. And there's more videos. This is Common Sense Medicine 2.0. We've got a new office. We've got new little toys to play with. Bobbleheads. Are you chronically suffering from bruises? Are you one of those people that you look at your skin and you like pull up your leg in and go, where did I get, where did this bruise come from? Oh wow, did you fall? No! I have no idea why I have that bruise. Would you like to figure out why you have bruises like that? I think you would. Hi, this is Dr. Michael Berglund and welcome to Common Sense Medicine. Today you're excited, aren't you? Today we're talking about easy bruising. Why do I have easy bruising? Oh, you're asking me. You're asking me. I thought you were going to respond. I was going to give you a moment. Okay, I'm going to answer this, okay? So here's the thing. We have bruising for a variety of different reasons. There is hemophilia. Hemophilia is a genetic disease. In the liver, you make these strands. They call them coag factors, right? You have they go from 1 to 12, I think. It's like the days of Christmas. On the first day of prothrombin. Hemophilia says I have a deficiency of these little strands. Then you have these things called platelets, okay? Platelets are made in your bone marrow, and bone marrow makes they're little corks, and they attract one another. When they find an area that's broken, blood is leaking out, the body will sense that there's a leak, and they start getting sticky, and they start getting stuck together, and then these strands come together, and they form a clot. Right? And so they stop the bleeding. That's the point of it all. And then over here we have what they call vascular integrity. Okay? This vascular integrity says, are the vessels solid? Are they holding the blood in place? We're gonna make a big loop. Are you excited? We're gonna make a loop like this. Okay? So we've got a heart. The heart pumps. It goes out through the aorta. And then it breaks up into arteries, right? And then those break up into arterioles, which are smaller. It's like branching of a tree, right? Till you get to and then we have capillaries. And the capillaries are like twigs, or the tiny little branches of twigs. And then we have capillaries. But the difference between a tree now, this is not what a tree does. We go blood through here, and then we have, from capillaries, we go to venules. And then we have veins, then we have the superior inferior vena cava, which are these big ones, and then it goes back to the heart. Okay, so we have this big loop from big to narrow to big again. So oxygenation to all the cells to getting reoxygenated. We're not concerned about all these other areas because you don't have bruising because your artery breaks. That's called an aneurysm. Okay, that's not what we're talking about. That's different. If that's going on, stop the video and go to the hospital because you're having an aneurysm. But if you have chronic bruising, okay, where you're just going, gosh, where is that coming from? Okay, so that usually happens up here in the capillary realm. They're semi-permeable, meaning liquid can get out, nutrients can get out, oxygen can get out, carbon dioxide and waste products can get in, but the blood cells can't get out. Here's the problem. Some people, they're almost too dainty. They're almost too fragile. So what ends up happening is it doesn't take much pressure at all, or even just pulling back or reaching your arm up, and all of a sudden some of these vessels start to tear, right? And then what happens is once they tear, what normally they held in the blood leaks out into what's called the extracellular fluid. A bruise is an area where blood cells leak out of the vessels. There will be pain with a bruise. Why? Because your body needs to get rid of all that blood. It doesn't belong there, so it creates inflammation. Inflammation is the way body marks what needs to be taken care of in the body. Capillary fragility is basically this, where those vessels break really easily. So what I'm telling you need to do, what works almost every single time, is we need to use certain antioxidants. I don't see vitamin C working great for this as well as I like grapeseed extract or even pycnogenol, but I prefer grapeseed extract. Grapeseed extract, get a good quality source. You can experiment with 100 milligrams, 200 milligrams, 300 milligrams, even 400 milligrams. Try and experiment and see at what point does it minimize the bruising. This is Dr. Michael Berglund. You've been visiting Common Sense Medicine. Thank you for being here today. You know what? This is going to be good. And today, sorry, I won't do this anymore.
Okay.
Today, we start off common sense.